For the cotton clunk test, I'm going to go ahead and stabilize the foot, grab the calcaneus, and for the cotton test, provide a lateral glide. For the medial glide test, you're going to go ahead and stabilize the foot or ankle and then push the calcaneus medially. Those would be positive if there was a clunk present or if there's about 3 to 5 millimeters of movement. For the heel thumb test, I'm going to go ahead and have the patient prone, and I'm just going to apply a little thump to the calcaneus. And that test would be positive if it reproduces pain. For the fibular translation test, I'm going to go ahead and stabilize the tibia, and I'm just going to go ahead and move the fibula anterior and posteriorly. And this would be positive if it reproduces the patient's pain or if there's more displacement present in the involved versus the uninvolved side. For the squeeze test, all I'm going to do is squeeze the calf, and that will be positive if it reproduces their pain. Okay. For the Kliger external rotation test, I'm going to go ahead and stabilize the leg here and bring the foot into external rotation. And this will be positive if the pain is present at the distal tib fib ligaments or the syndesmosis. For the anterior drawer test, you're going to have the patient lying supine, have their foot slightly plantar flexed in about 20 degrees, and they're relaxed. And I'm going to go ahead and stabilize the tib fib, and I'm going to grasp the talus and go ahead and pull it anteriorly. This would be positive if there's a clunk or if it reproduces pain, or if there's more displacement noted on the involved versus the uninvolved side. For the Taylor tilt test, I'm going to have the patient sideline. I'm going to have their foot start out in a neutral position. And all I'm going to do is grasp the talus and apply force medially and laterally to just tilt it. And this would be positive if the clunk is present or if it reproduces pain or if there's more displacement noted on the involved versus the uninvolved side. All right, for our Homan sign, I'm going to go ahead and dorsiflex the patient's foot, and then I'm also going to squeeze the calf. And this would be positive if this reproduces the patient's pain. For the Berger's test, I'm going to go ahead and elevate the patient's leg to 45 degrees. Hold this here for 3 minutes, and I'm looking for any blanching going on at the foot of the leg. And after 3 minutes, I'm going to go ahead and dangle the patient's leg off the side here. And this would be positive if it takes more than a minute for the leg color to turn back to how it was normally. For the Thompson test, I'm going to go ahead and squeeze the patient's calf, and I'm going to watch the foot here. This would be positive if the foot plantar flexes after the squeeze. For the Maddles test, I'm going to go ahead and ask the patient if they could just bend their knee, and I'm going to be watching the foot here, and they can bring it back down. And this would be positive if the foot falls into a neutral or if it dorsiflexes with knee flexion. Relax. For the Royal London Hospital test, I'm going to squeeze the patient's Achilles tendon and then release that. And then I'm going to go ahead and have the patient dorsiflex their foot. And then I'm going to squeeze again and then release. And this test will be positive if if it was less tender, less painful after squeezing with the dorsiflexion. For the Tinel-Steiner test, I'm going to go ahead and tap the anterior branch of the deep fibular nerve here. And then I'm going to go to the posterior tib nerve here and tap there. And this test would be positive if it reproduces the patient's pain. For Morton's test, I'm going to go ahead and squeeze the metatarsals near the head. And this would be positive if it reproduces the patient's pain. For the functional ileus limitus test, I'm going to go ahead and put the patient into subtalar joint neutral. And then I'm going to go ahead and extend the first the halix. And I'm looking if there's any plantar flexion going on at the first metatarsal. And this would also be positive if it reproduces the patient's pain. When checking the phi line of a patient, I would usually have them stand normally in a weight bearing position, but just so you can see his foot a little bit better, I'm going to have him stand like this. So I would palpate for the medial malleoli, find the navicular, and find the first MTP joint. Now normally the navicular should be in line with the medial malleoli and the first MTP joint. So yeah, this would be a little bit abnormal here. For the windlass test, same position as the phi line. I would have the patient normally standing with their feet side by side, but just so you can see the foot a little bit better, I'm having him stand like this. So in a weight bearing position, I would go ahead and extend the halix. And this would be positive if it reproduces the patient's pain.